of health. So here's a quick outline, a little introduction. I'm going to talk about what the goals of speech movements are, what we think they are, and feedback and feed-forward control mechanisms, and then a little summary. So articulatory movements are what generate the sounds that convey the linguistic messages, and that's what we're going to focus on. So this is an image from a trying to get a good angle here. Better. This is an image from an X-ray film taken from the side of a speaker, and you can see there are some structures here: the soft palate, the lips, the tongue blade, the tongue body, the mandible, the hyoid bone, and the larynx. And I'm going to play a little segment of this X-ray movie, and just watch the movements of the structures, especially the tongue. They're extremely complicated.
Why did Ken set the soggy net on top of his deck? I have put blood on her 2 clean yellow shoes. Stop.
Okay, so can't see the muscles, but just to give you an idea, there are many muscles controlling these movements. And we're not even looking at the respiratory system, which has to be coordinated with these movements. So the point here is that this may be the most complicated motor behavior that we know about. There's a very large number of degrees of freedom that have to be controlled, and of course a very complicated control problem. So one of the key questions that we've asked ourselves over the years is, what are the fundamental control variables? It's a kind of a classic question in the control of movement. So to guide our thinking about that, we think about what the objective of the speaker is, which is to produce sound strings that have acoustic patterns that result in intelligible auditory sensations in the listener. And so to get these sound patterns, there are a number of parameters that could be controlled: levels of muscle tension, changing lengths of the muscles and movements of the structures, the overall shape of the vocal tract, the aerodynamics that result from these movements, and of course the acoustic properties of the radiated sound. So now the control variables could be any combination of these parameters. There are different theories about what they are. The 2 main theories that are current in our field are that there's the underlying units are articulatory gestures. You've heard something about that. And then the other point of view, which is the one we take, is that the goals of the movements are in sensory domains, patterns of auditory and somatosensory sensation. So I'm going to be mentioning a model that was developed by Frank Gunther. You're going to hear about this later from him. It's called the DIVA model, and what it does is essentially quantify a neural theory of speech motor control. And this is a computational model of relations among phonemic specifications of sounds, cortical activity, motor output, and the auditory and somatosensory consequences. So this is a simplified block diagram of the model. It's got 2 control subsystems. This is has a lot of similarities to the Wolpert model that Art was talking about. There's a class of models that incorporate these principles. A couple of the more prominent ones come from Kawato and Jordan. And in this kind of model, there's a feed-forward control system here on the left, a feedback control subsystem. The output of the model so the input of the model is a sequence of goals, and the output of the model are commands to the muscles. And in this kind of model, in particular in the DIVA model, the phonemic goals, the goals for the speech sounds, are projections or mappings from premotor to sensory cortex, auditory and somatosensory cortex, that encode sensory patterns that are expected when producing the speech sounds. And these patterns correspond to regions in multidimensional auditory temporal and somatosensory temporal spaces. So the feed-forward control mechanism is used for skilled, rapidly sequenced movements. It operates independently of external feedback. The feedback control is used to teach, refine, and update feed-forward control mechanisms, and this is based on the detection and correction of errors. So this model is particularly interesting to us because if you connect it to a speech synthesizer that will generate vocal tract shapes, moving vocal tract shapes, it will account for a number of observations that have been made over decades of research in speech, economy of effort, co-articulation, motor equivalence, certain aspects of acquisition, and responses to perturbations. So I'll talk a little bit about phonemic goals now. There's a general agreement that properties of the speech production and perception mechanism help to define these phonemic goal regions. And we've heard a little bit about this earlier in the meeting. Some of these properties are characterized by what Ken Stevens calls quantal effects. They're also called saturation effects. And this little diagram from Stevens is a schematic illustration of what a quantal effect is like. So you have on the vertical axis here some acoustic output parameter, and on the horizontal axis some articulatory parameter that has a kind of a continuous range of control. And you can see that there are, for this continuous change in the input, here, there are a couple of stable regions where the output doesn't vary very much, and then there's an intermediate unstable region. And so one example of this is constriction location for the vowels E, A, and U. You can vary that a little bit, and the output doesn't change much. The theory is that sound systems tend to utilize these stable regions and avoid the unstable regions, and also that individual speakers can also use this kind of relationship to help produce robust acoustic cues with relatively imprecise motor commands, and I'll show you an example of that as we go along. There, of course, are many influences on sound systems. Clarity versus economy of effort that Bjorn Lindblom has talked about over the years. And then there's a factor that we don't usually talk about very much, social factors. So what people who speak, say, dialects, different dialects, want to sound different from the other dialect, and that also influences what the sound system of a particular language can sound like. And some of these factors, such as the social factors, are not easily modeled, which means that it's difficult to find evidence for these underlying quantal mechanisms when you just look at a running speech signal. So how do we measure speech? Well, of course, measuring various aspects of the acoustics are very important. We measure speech spectral amplitudes, temporal amplitude and temporal measures. We measure also in our lab movements with an EMMA, our own version of the EMMA system, points of on the tongue, lips, and jaw, and you saw the commercial version of this thing in Barbara's presentation. We call ours the EMMA, and here's just a little brief example of how we might run an experiment. There are a couple of these little coils.
Say who hit it.
They're
Say Shad hit it.
electromagnetic fields
Say
being
who hit
generated
it.
here.
Say who hit
And
it.
there are 3 points on the tongue in red and
Say who
points on
hit
the
it.
lips and the jaw in blue. So here's what a little bit of these data look like after they've been digitized and shown on
Say
the
who'd
computer.
hit it. Say who'd hit it.
That's the palette, that line there. So using measurements like this, we've come up with a number of observations I'm going to talk about now. So the first phonemic goal I'll talk about, or set of goals I'm going to talk about, are for the sound s and sh. So like said and shed in American English. There's an auditory goal for this sound contrast. This is a spectrogram of sh and of s. S has a higher concentration of spectral energy than sh does, and if you measure the kind of center of gravity of each of these spectra and take the difference between them, you get what we call contrast distance. So you have acoustic contrast distance. And in terms of what the somatosensory goals might be like, here's a mid-sagittal schematic diagram of how you produce a sh. You kind of make a groove in the tongue blade here and position it on the alveolar ridge, so you get a narrow constriction. That results in there being a cavity underneath the tongue, which we call a sublingual cavity. And so noise is generated here, and it excites this kind of complicated acoustic resonator in front of the constriction. A s is a little simpler. You just push the tongue forward. You can have a narrow groove here. There's no sublingual space, so the resonant cavity is smaller and less complicated, and that means you get a higher frequency concentration of energy. So here's an illustration of what a saturation effect could look like in the production of this contrast. Here's the volume, a schematic view of the volume of the sublingual cavity versus where the tongue is located. So if you start in the sh configuration and gradually move the tongue forward, you gradually decrease the volume of this cavity. There comes a point where you obliterate or eliminate the sublingual space, so the volume suddenly drops like that, and then of course the spectrum changes in a similarly abrupt manner. And of course, after the contact is made, you can keep pushing on this forward movement, but the space can't get any smaller. So that's kind of an example of one of these saturation effects. Any closure, anytime two articulators come into contact, which is every consonant, different kind of consonant, is characterized by a saturation effect like this. So now I'll talk about an auditory goal for a vowel, the vowel oo in American English. This is what the articulation looks like for this sound. So you make a narrow constriction here and a narrow constriction with the lips. And from modeling the relation between the vocal tract shape and acoustics, it's known that there's a many-to-one relation. You can have a large number of different articulatory configurations which give you essentially the same acoustic output. So based on that sort of background, we had a hypothesis that if you looked at many repetitions of the vowel oo, sometimes you would see a trading relation among these two articulations. Sometimes you'd see a higher tongue and less rounded lips, and other times you'd see a lower tongue and more rounded lips. So you'd have this kind of motor equivalent trading relation. Well, here's a bunch of data that we got, many repetitions of the vowel oo, points in a single subject, points on the tongue body, the lower incisors, the upper and lower lips. And here's the plot of the relation between tongue height and upper lip protrusion, lip rounding. And so this negative correlation indicates that we have such a trading relation. The findings like this, so what we see is that the articulator positions vary from one repetition to the next. So we infer from this kind of result that the goal for these movements for the vowel oo is in an auditory or acoustic frame of reference versus a spatial or a motor frame of reference. Frank, in an experiment that we did in collaboration, found a similar kind of result for the sound R in American English. So how are phonemic goals learned? And of course, we know that auditory feedback is critical for that. If somebody is born without hearing, they really can't learn how to speak fluently. On the other hand, people can be born with hearing, then in adulthood lose it due to some disease or something. They can become profoundly deaf. So they could keep speaking intelligibly for decades. You could understand them, but over time, their speech deteriorates somewhat, so the clarity becomes somewhat diminished. The contrasts become decreased somewhat. And this is an example of a person like this. acoustic measures of the contrast between the sound L and R. The normative data are represented by these capital red letters. And here's a bunch of repetitions of L and R in context words by such a person who is postlingually deaf and has been so for some time. So you can see that the sounds are distinct from one another, L here and R here, but they're touching. I mean, so the distributions overlap a little bit, which means that, say, in a noisy environment, if you couldn't see the speaker's face, there's a possibility for some confusion or lower intelligibility. So people like this these days get a cochlear implant, and so they have kind of restored prosthetic hearing. And here's what's happened to this person after 6 months with a cochlear implant, using the kind of restored auditory feedback. They've kind of increased the contrast again. And this is the kind of thing that we see a lot with cochlear implant patients. They usually show parallel improvements in perception, production, and intelligibility of their speech. So we observe from studies like this that phonemic goals are essentially stable, but the degree of contrast can decrease, and we think that this stability comes from well-ingrained feed-forward commands and somatosensory goals, which of course are not affected by hearing loss. So we've done a number of experiments on the nature of sensory goals. There's a lot of background to this that I won't take the time to go into. One of the observations here, of course, that's important for this meeting is findings of mirror neurons. So all of these observations indicate close linkages between production and perception. One important observation here that kind of underlies a lot of our experimentation is that there are ubiquitous interspeaker differences in almost any time you make any kind of a measurement in speech production. So this background leads us to another approach to investigating relations between production and perception in speech, and our hypothesis is as follows. Speakers who discriminate well between speech sounds with subtle acoustic differences will produce more clear-cut contrast, greater contrast distances. And speakers who are less able to discriminate well between the same sound stimuli will produce less clear-cut contrasts. So we've done experiments on this hypothesis, one with vowels. So we had 19 speakers. We recorded their articulatory movements and the sound output. They were saying things like, say cod hit it, say cud hit it, say hood hit it, and say hood hit it. So we have two vowel contrasts, and and they did this in 3 speaking conditions, normal, clear, and fast. Here's an example of the articulatory data from one of the subjects. These are the 3 points on the tongue. This distribution is for this is for and so from data like this and analogous data in the acoustic formant space, we calculated contrast distance, which is the distance between the center of these 2 distributions. So we had articulatory contrast distance and acoustic contrast distance. On the same subjects, we played synthetic stimuli to them from continua, synthetic continua, cod, cud, and hood, hood. And we measured their ability to discriminate between these stimuli. And here are the results. First, we found that the subjects fell into 2 groups in terms of their discriminators, high discriminators and low discriminators, so they varied in their auditory acuity. And, and here's what the results look like. So what you have here on the left are the contrast hood, hood, cod, cud here. These are measures from the vowels. The vertical axis is articulatory contrast distance on the top here, acoustic contrast distance on the bottom. You have the 3 speaking conditions, fast, normal, and slow. And what you see is that the high discrimination subjects produce greater contrast distance than the low discrimination subjects, and this is measured in articulation and acoustics. So the conclusion here is the more accurately a speaker discriminates a vowel contrast, the more distinctly the speaker produces the contrast. We did a similar kind of experiment for the S-sh contrast. I've already told you how that contrast is produced. And we measured contrast distance. And we found that the people who had better ability to discriminate s from sh produced greater contrasts. We also measured the consistency of the contact of the tongue with the lower alveolar ridge here during S, which means the consistency with which they use this saturation effect. And we found that the contrast distance is also related to how consistently people use this difference in contact versus no contact during producing the s-sh contrast. So we find, remarkably enough, in people who come in who've been deaf for maybe a decade or two, that they're still producing the s-sh contrast without being able to hear a thing. And this may be because, partly because these somatosensory goals contribute to the stability of this contrast. Okay, so why do we find this relation between acuity and the strength of the produced contrast? Well, referring to the way the DIVA model operates, we have the following explanation. We assume that when children are learning how to speak, they discover that it's advantageous to them to be as intelligible as possible. So that means that speakers who, will form goal regions that are as distinct as possible, and speakers who can perceive fine acoustic details will learn auditory goal regions that are smaller and spaced further apart than speakers with less acute perception. So here's a schematic illustration of this, goal region for the vowel I and eh, and here's the goal regions for a high acuity speaker and a low acuity speaker. And so this will happen because those with more acute perception, these people, are more likely to reject their own poorly produced tokens when learning the goal regions. So this guy will reject this, this particular token, but the low acuity person will accept it. So overall, we think that the phonemic goals are regions in sensory spaces. So we've done some experiments on feedback control of the movements based on this view of what the goals are like. This is an experiment that was done by a graduate student of Frank's, and it used a setup that we developed in our lab in collaboration with Frank and his students. And it looks like this. The subject is sitting in a booth. He's seeing what he's supposed to say on a display, speaks into the microphone. The speech is recorded, but it also goes through a digital signal processing algorithm which shifts in nearly real time the first formant frequency, and that altered signal is fed back to the subject through headphones. So the subject, once in every 4 trials or so, and the subject couldn't predict when this would happen, the subject, instead of hearing an unshifted first formant, would hear a vowel sound in which the first formant is shifted. Okay, so this is what the average results look like. So the vertical axis is here is the difference between the shifted and unshifted formants, and this is what the subjects do. So when the first formant, F1, is shifted down, the response is for the subjects to shift them up, and vice versa. So what we have here is a compensatory adjustment in the articulation based on this acoustic perturbation. And these corrections, which is essentially what's going on here, become evident around 100 to 150 milliseconds from the time of the shift. So this is an example of within movement closed loop error correction. And you can observe these kinds of things if the movement lasts long enough. If the perturbations like this are long-term, say you get a denture, and all of a sudden your sounds are different, or, well, you don't have, I mean, you rarely experience long-term acoustic perturbations, but if you have a perturbation that lasts long enough, ongoing, then the corrections that are made like this will be incorporated into feed-forward commands. Here's another experiment on closed-loop error correction, this time with a somatosensory perturbation. This was done in collaboration with David Oskry, who owns this robot here. This is David. In these experiments, you might have read about some of this, the robot follows the jaw movements, except every once in a while it will arrest the jaw movement or push it up or down, okay? And so in this experiment, we did these perturbations in a small percentage of the trials, and the subject was saying an utterance like "see red," and many times. And in 100 repetitions, based on a trigger that's linked to the beginning of downward jaw movement here, there were 10 perturbations that pushed upward, resisting the opening, and 10 perturbations that assisted the opening. And so what you have here in this plot is the jaw movement versus time. This is the kind of not unperturbed, the 80 unperturbed movements. Here are the perturbed up movements, the perturbed down movements. You can see that the jaw doesn't really correct. It remains in its perturbed position. If you look at the acoustics as a function of time, F2 minus F1, here's the unperturbed acoustic tracks. It's a little messy, but you can see that after about 90 milliseconds or so, the formants begin to recover. So there's a correction that's introduced. Since it's not the jaw, the compensatory articulation must be coming from the tongue. So here was another example of within movement closed loop error correction. This could be based on auditory and or somatosensory feedback, and we hope to uncover that in future work. Now, let's see. We've also been interested in the timing of these changes in various kinds of acoustic perturbations, other kinds of perturbations, and one of them is just simply blocking or restoring auditory feedback. So you have an experiment in which the subject is saying the same small number of utterances in random order a number of times, and at unpredictable intervals you either block their hearing, if it's a hearing, well, in this case we were doing this with cochlear implant subjects, which makes it easy to block their hearing. You just turn off the microphone to their implant. And so these people were saying multiple repetitions of utterances. It's kind of a little confusing here. 2-word utterances like don, shad, don, sad, done, shed, and done, said. And so what we have here are 2 vowel contrasts, ah versus in the first word of the utterance, and ah versus in the second word of the utterance, and then we have the sibilant contrast in the first position in the second word. And so this is what the paradigm looks like. So they're going along saying this. We have a voice-activated switch that when the computer arms it, it changes the hearing state from blocked or unblocked to within 20 milliseconds of the onset of the vowel in the first word. So here, the switch turns off the hearing, and then we're recording these utterances, and then and so here's a bunch of utterances with hearing blocked, and then we restore the hearing, and then there are more utterances, and so on. So the kind of measurements we made were of 2 kinds of parameters. We think of parameters in terms of the time span over which they change. So there are segmental parameters. Those are the speech segments or the phonemic parameters. And then there are supersegmental parameters that are manipulated for prosody, like fundamental frequency contours, loudness contours, and overall speaking rate. So we measured those 2 kinds of parameters, the supersegmental parameters and the contrast distances for the vowels and the sibilants. And what we did was around each switch, we averaged the values in the last 3 utterances before the switch, and then we looked at how those values might have changed in the first utterance, after the switch, the second one, and the third one. Okay? So the results showed that the segmental contrast, the phonemic contrast, didn't change consistently when you either blocked or restored hearing. On the other hand, there were consistent changes in the suprasegmental parameters. The easiest one to talk about is vowel duration. And so this is a kind of a tabular display of what happened. When hearing was blocked during V1, in the first utterance after the switch, the duration increased, okay? When hearing was restored, there wasn't a change during V1, but there was a change during V2, okay? So this is, hearing block durations increased in vowel 1, utterance 1, and decreased with hearing restored for vowel 2, utterance 1. So we think that the difference between the effects of blocking and restoring here have to do with neural processing and muscle activation delays. It would be, yes? Okay, so the subject is saying, Don said, I was afraid of this. Don said, Dunn shed, Don said, okay? And they're hearing. And well, they're hearing through their implant. Then all of a sudden, they can't hear. And then they keep talking for 10 or 12 more utterances, and then they can hear. No, this is without delay. It's, I'm sorry, no delay, no alteration of this, the acoustics, just you either hear it or you don't. Okay, does that clarify it? Okay, so I won't go into it. We can talk about this if there's a question, but the important thing here is, as you can see from the table, the changes were maintained until the next switch. Similar things happen with fundamental frequency and sound level. Now, the explanation is all of these vowels were greater than 150 milliseconds long. So we interpret this increase here in duration when hearing was blocked as a closed loop error correction. A closed loop response of the suprasegmental parameter to change to having hearing blocked. And normally, these suprasegmental parameters, we all adjust them all the time to changes in the acoustic environment. When it gets noisy, we talk louder and slower because we want to make sure we're remaining intelligible. So the interpretation here, the segmental parameters, according to the way DIVA functions, shouldn't change when hearing is blocked or restored, only when hearing is modified, only when there's an error signal that comes from a difference between the expected and the resulting acoustic consequences. But when you're just blocking or restoring hearing, there's no real error signal to cause a change in a segmental parameter. On the other hand, and so we think that there's a different kind of feedback mechanism operating over a longer time span for the suprasegmental parameters that is used to regulate their control. Okay, so I'll make it to 45 minutes, but I don't know if there'll be much time for questions. So we've done some experiments on feed-forward control using the same kind of apparatus. This is an experiment that was originally done by Hood and Jordan. It's been replicated by Purcell and Munhall. It's a sensory motor adaptation experiment. This apparatus was used in this experiment, but in a different way from the one I just talked about before. The hypothesis here is that adjustments will be made in feed-forward control to maintain an auditory target. So here the subjects hear their own vowels with F1 shifted with a short delay, and they're unaware of the shift. And here's the paradigm. There are 18 different words, all containing, most of which contain the vowel eh, that make up a block of stimuli. The subject sees these one at a time and gets many blocks. So the experiment lasts over an hour. And this is what the paradigm looks like. There's a phase here where there's no shift, and then there's a phase where shift is gradually increased. Then there's a phase where the shift is maintained, and then there's a phase where the shift is turned off, okay? 10 subjects get an upward F1 shift, 10 subjects get a downward F1 shift. Here's what happens, okay? Here's the baseline phase. This is the average first formant in the vowels of the subject who get the downward shift. This is the results for the subjects who get the upward shift. So you can see they're compensating. So it's the idea is you're saying bed, you start to hear something a little like bid without really realizing it, and in response you say something a little like bad, okay? The shift, notice, is foreman specific. We're only shifting F1, and that's the only one that changes. And subjects aren't aware that this is going on. So in terms of the model, what we have here is a mismatch between the produced, the expected, and the produced auditory sensations, which lead to error correction, which are incorporated into feed-forward commands. And what convinces us about that last statement is that there's an after effect. So you turn off the shift, and the compensatory response decays only gradually. So there's a change in feed-forward commands that sort of washes out here. Now, among the 20 subjects, they varied in the amount of compensation that they produced. And we were considering why this may be the case and wondering whether it's an effect of goal region size, the finding that we, and conclusion that we came to before. So based on this background, we hypothesized that speakers with more, as I said before, with more acute auditory discrimination have smaller goal regions, and so that would lead us to the hypothesis for this experiment, that more acute perceivers will compensate more for the shift in F1, and this is a schematic diagram of why that may be the case. Here's a high discriminator and a low discriminator, the vowel region for eh. Here's the perturbation. So in order to get back into the acceptable goal region, the high discriminator has to compensate more than the low discriminator. Okay, so we measured a subject's auditory acuity in terms of their just noticeable differences for the acoustic stimuli, and we found that the amount of adaptation was related to their acuity. It was also related to the size of their vowel spaces, and when we partialed out the vowel space size, we get a highly significant result. I think I'll skip this last, so we have a couple of minutes for discussion, and I'll skip the summary. And I just want to come back to the final slide here to bring us back to the DIVA model and point out, as you'll hear in detail later this morning, that the DIVA model has components, has hypothesized correlates in cortical activation and connectivity here. And these hypotheses can be tested with brain imaging, which is what Frank does in his research projects. So this means that we can quantify relations among phonemic specifications of utterances, cortical activity, movement, and the sound output. And so I think I'd like to suggest in the theme of the meeting here that what we have here is part of a neural, I'd say we go further than a theory, because this is a computational model of a component of language. And I think, of course, I'm biased because I'm a collaborator of Frank's, but I think this represents a nice kind of paradigm for the kind of thing we should be aiming for in general in answer to the question that's posed by the conference. Thank you. Francesco.
It's just half technical, half question. When you were showing the data from Austria, I get reminded of a work by Lubker and I think Thomas Gay, where they were putting this...
Byte block.
Yeah, the dynamic byte block, the one with the electrical shocks to the masseter.
Tricky.
Yeah.
I think those kind of results are difficult to interpret.
Okay, that's what I was going to ask you, because there was a suggestion that there was some critical period of planning where they would not, subjects were not able to recover. They would sort of give up compensating. There was some I don't recall it really, but it was not always that they could compensate as you were suggesting. Does
I think
anyone?
the more current results, I mean, the experiments you're talking about are 3 decades old.
Oh yeah, I know.
Yeah, and so the more current results, they're pretty, and we're not the only one who's seen things like this, are that we're finding closed loop responses with a delay of, you know, it's rough, but less than 150 milliseconds, sometimes as short as around 100 milliseconds or even less.
I'm
Yes.
here. So just to better understand, because I like your idea of phonetic goal, and it's quite in line, on the same line of what we think about, for example, how the brain drives the hand in order to achieve a goal, so it's perfectly on the same stream. But about perception, so could you a little bit better explain how do you see the role of the motor system, if you believe that there is a fundamental role of the motor system in the perceptual
Okay, so
aspect?
there's been quite a lot of discussion about that, and we've talked about it on
Yes.
the bus and so on. I think that what's going on, just based on my personal biases from having done all of this work and paid attention to what other people are doing, is when you're learning how to speak, it's a highly skilled movement, which means you're practicing a lot. You don't really learn what the sounds of languages are by just observing them. So you have to produce something to incorporate it into your lexicon. And so you have a kind of inherent production-perception relation just built into the lexicon, okay? And I think that's how it goes. I mean, people find themselves all the time sort of making little movements when they're listening. And I think that's part of perception because of the practice that's required for skilled movements. You could take, the experiment might be hard to design, but you know, I think that's my idea of why you see this link. First, you have to be able to, it's clear, the perception has to come first, or else you can't form the goals in the first place. But after you've built up these loops, this perception-production relations, and you become skilled, you don't need the auditory feedback to be able to speak anymore.
True, that's true for sure. You know the story of the talking hand? The talking hand. So they use this data glove in order to, and the subjects, they became capable to speak by using their hands. So the motor system is flexible in adapting to new sensory motor loops for sure. So it's not so rigid. So this is maybe in line with the...
Yeah, I mean, yes, Art.
Question. Would you suspect that children who have motor difficulty will eventually, may eventually develop perceptual difficulty if their motor system is not as finely tuned? And I'll tell you why I'm asking the question. It's an idea I've had for a while regarding children with SLI, specific language impairment. And we know that there's a correlation between SLI and motor clumsiness, motor ability, and the hypothesis that maybe these children are never able to learn the fine discriminations because their motor system doesn't allow for the fine distinctions, and then that cascades into other language problems.
That's one possibility, and the two possibilities are not mutually exclusive, but it's also possible that that they have a perceptual deficit, and this is a kind of an underexplored area in speech pathology, in language delay, and what look like articulation problems in children. Part of that could be due to auditory deficits, just partly because of natural variation in auditory capabilities, but maybe going further than that in people who have more serious problems.
I would like to comment this question. We are testing children with that they had palatoschisis, you know, the draft of the palate that could be partial, only anterior or only posterior or medial. In order.
Oh, that's my computer. I'm really sorry.
He doesn't agree.
I didn't program it to do that. It just did it.
In order to see, and of course, these kids have been operated very early. However, we wanted to see if this difficulty in maybe babbling at the beginning had a terminal a consequence on the perception. And of course, you can't say bread and ask, what do you think I said? You need to have a very subtle measure of perception. And we have used the McGarg effect. You know the McGarg? It's a sort of illusion that you create by mixing the visual and the acoustic consonants, different consonants, so you perceive an illusion, an illusory acoustic perceiver. And we have preliminary data, and it seems that anterior patients have a different performance than posterior. So we will see.
While we're setting up the next, I'd just like to thank the organizers for inviting me, but also for the fantastic job that they've done. And that's, I mean, we thanked Mirko last night, but we should really also thank Barbara and Lila and everybody else who worked on this meeting. I think it's great. Thank you very much.